As we mentioned earlier in the show, the Canadian border is once again open to non-essential travel from the United States. The lifting of some border restrictions comes at the same time that COVID-19 cases are on the rise in the US and Canada, driven by the highly contagious Delta variant. The Public Health Agency of Canada reported a 43% increase in the number of new cases last week. The spike in cases is causing anxiety and concern amongst parents, school administrators, and teachers in Ontario. Students across the province are set to return to in-person classes in less than a month. Well, joining me now is Dr. Raywat Deonandan. He is an associate professor of epidemiology and a science communicator specializing in global health at the University of Ottawa. Dr. Deonandan, thanks so much for joining us.
It's my pleasure. Thanks for having me.
Dr. Deonandan, how would you assess the state of COVID-19 in Ontario right now?
Well, we were doing fairly well, but now it looks like we've entered the realm of exponential growth, right? The reproduction number is above 1, so it looks like we're looking down the barrel of a fourth wave. But things aren't that dire that we can't do the right things and prevent things from getting worse. So we have an opportunity, a window of opportunity here to make some policy choices and some behavioral choices to mitigate a potentially bad fourth wave.
What does it mean to be in a fourth wave?
Well, all it means really is that cases are going up in a noticeable fashion and they'll come down again in the future. So it's an increase in cases. There's no magical metric for what determines a wave. But it also might mean that we're entering the endemic phase of this disease, which means we're going to tolerate sustained transmission for some time. We don't need to, though. We have the tools to control this disease. At this point of the pandemic, it's a matter of political will and public enthusiasm for whether or not we'll use those tools. And the major tools, of course, are vaccination and mask wearing. We need to use them at scale.
School is less than a month away. Yesterday on social media, a senior scientist and epidemiologist at Toronto Sick Kids Hospital said that based on what he is seeing with the numbers, he will not be sending his kids back to school in September. Given your own assessment of the numbers, is that a wise thing for him to do?
It's understandable, and it depends on where you live, of course. These things are going to be heterogeneously distributed across the province, some hot zones, some not. It all depends on what the rate of transmission is in your community and what steps are being taken in the schools to keep the disease out. Is there ventilation improvement? Are there mask mandates? Are there vaccination of staff? All these things matter.
Would you advise parents in Ottawa to keep their kids home in September?
Ooh, I'm not touching that question. I would advise parents to make an assessment based upon a set of indicators. What is the level of transmission at the time? Is your child vaccinated if they're eligible? What is the vaccination status of all the teachers in that school? And what is the ventilation quality in that school? Do they have HEPA filters? Do they have air purifiers? Is this a priority? And what are the masking policies?
Does a ventilation system matter? We know that last week, Ontario's Education Minister, Stephen Lecce, pledged to invest about $25 million to improve ventilation systems in schools before the return to school in September. Is improving ventilation the answer to keeping kids safe in schools?
It's a big part of this. There are about 4 tools we can use: vaccination, mask wearing, ventilation, and larger public health surveillance and testing and tracing and isolation. But ventilation is one of those pillars because COVID is airborne. In fact, the Delta variant might be the most infectious respiratory virus that we've ever seen. And one way to control that is to make sure there's good airflow and things like that to dilute the load in the air. So ventilation is a big part of this.
You say that the Delta variant, obviously, it's virulent, it's very, very dangerous. But we're hearing, from Dr. Anthony Fauci that if this Delta variant is not controlled, things could get much worse.
Yeah. As I said, there's some suspicion it might be the most contagious respiratory virus we've ever seen, which is terrifying. So the problem with the Delta variant is it's hypertransmissible and might be more serious. And that means that it raises the threshold for herd immunity and challenges our vaccine effectiveness somewhat. So we got to vaccinate a lot more people faster to get this under control. And we have to use other tools like mask wearing to make sure that we can artificially reach herd immunity in the meantime. So use all the tools at our disposal. We have the tools, we just have to use them.
So given the fact that the Delta variant is spreading, we know that cases of COVID-19 are surging in the United States. They're also increasing here in Canada. Does it make sense that Canada just opened its border to fully vaccinated U.S. residents for the first time in a year and a half?
It's a curious choice. And I'm sympathetic to people in the tourism industry, for example, with people with families straddling the border that need to be reunited. But It's an odd choice for this timing. I think right now our priority should be making the school openings as effective as possible. And the single biggest way to make schools safe is to reduce the probability of transmission in the community. And one way to do that is to avoid importing infection from a neighboring country like the USA. So it's an odd choice to that extent. Now, the actual policy involves making sure everyone's doubly vaccinated, making sure they've got a negative test. The details matter. For example, is this negative test a PCR test, which is good, or a rapid test, which might miss some cases? And what is the follow-up like? So I like to see the details before I have any sort of good opinion on this matter. But if I were making a decision, I would not be opening the borders right now. The timing is not right, given how close we are to school openings.
Last week, Quebec Premier François Legault announced that his government would be imposing a vaccine passport system across his province to curb the spread of COVID-19. And it would mean that some non-essential services would only be available to vaccinated people. As an epidemiologist, do you believe a vaccine passport system is the way to go? And should Ontario be following suit?
Well, we know it's effective. We know this because the moment that Quebec announced they'd be doing it, their bookings for vaccinations doubled. So it is a way to increase uptake amongst that segment of vaccine resistant who are largely apathetic. It's a kick in the pants for them. So it's useful to that extent. And really, its biggest role is as an economic incentive to have vaccine uptake so we reach herd immunity faster. On a day-to-day basis, it may create some resentment, but the important part about vaccine passports is that no one is being denied service. It just means that if you're not vaccinated, you got to go through a couple extra steps, like proving you're not infected by doing a swab test. So that's an important ethical consideration. No one is being denied service, just that some people have to do a couple of extra things.
Is there anything else that you would like to see governments do to ensure that we keep this disease at bay?
Well, as I mentioned, the major tool is vaccination, and we have the policy tools to really increase vaccine uptake. And there's a certain segment of society that wants to be vaccinated but can't because they can't get a time off work, they haven't got childcare, they haven't got a vehicle to get to the vaccination site. That's low-hanging fruit for policymakers. Make it as easy as possible for the unvaccinated who want to be jabbed to get a jab. Then we can incentivize the rest. What kind of incentives? Well, the lottery system being used in some U.S. states seems to be attractive to some extent, and the vaccine passport system will be a kick in the pants for the apathetic component. And for the vaccine hesitant who care about the potential negative side effects of vaccine and who are swimming in misinformation, we need to deploy better education tools to cajole and incentivize people to accept vaccination.
Dr. Deonandan, it's very good of you to join us. Thanks so much.
It's my pleasure. Thank you.
Take care.